Okay, good afternoon, Amar.
Hi.
Welcome to my office.
Thank you.
I'm Samantha. I'm the health educator at North.
It's nice to meet you.
Nice to meet you too. I wanted to bring you in. The provider let me know you had some questions about birth control and possibly switching methods.
Yes.
Awesome. Okay. Before we get started, I wanted to let you know that our visit is confidential.
Okay.
So that means that anything that you share with me is confidential, with the exception of if you tell me you're thinking of hurting yourself, thinking of hurting somebody else, if you tell me someone else is hurting you, and then since we're in the state of Colorado, there's a legal age limit for your partner that you're having sex with. If you turn around behind you, there's the list. Any of those things I would have to report it just to keep you safe.
Okay.
Do you have any questions about the confidentiality piece?
No, I do not.
Okay, thanks. All right. I wanted to let you know a little bit about me.
Okay.
My pronouns are she, her, and ella. Do you have any pronouns that you like to go by?
Yes, I go by she, her, and Aya as well.
Okay, awesome. Perfect. I'll make a note of that.
Thank you.
All right. And I was wondering if you've thought about, do you want to be pregnant in the next year or what that looks like for you?
I would like to not be pregnant in the next year, maybe not for the next couple of years.
Okay. And are you currently on any birth control?
I was previously on the pill, but I didn't like it, so I want to look at my options for what I can get on now.
Okay, awesome. So it sounds like you have used the pill before and you have some experience with that. Do you have any experience with any other birth controls?
I have no experience with anything else. I only really know about the pill, but I definitely love to know about my other choices I have.
Okay, fantastic. Well, I do have some methods here that I like to share with you.
Okay.
And they are presented in tiers. So the first tier is going to be the least effective methods. So we have what's called typical use, which is like what the everyday person does. And then there's something called perfect use, meaning that the person does the methods exactly as prescribed by the doctor, never misses 100% on top of it. So let's say that somebody used one of these methods right here. On this worksheet it shows if 100 women use these, 12 out of 24 in 1 year would end up pregnant. Can you think of a reason why that could be, why that number's so high?
Maybe just because they're not very effective.
Yeah, it could be the effectiveness, and that is like pulling out, that's not always a guaranteed method. Different people might not be able to guess when they're ready to ejaculate. So
Okay.
if they're using that as their 100% method, then if they're not really exactly sure of their own body, then yes, that would be a reason why it would fail.
Or maybe they're not able to, for example, get condoms and be able to use them since they're
Okay. Yeah, that's a great guess.
Okay.
Yes, for sure. And then moving on to this next tier, these are different methods where the person would take, with a pill, you would take one pill a day, and you have to remember to take it at the same time every day. It's really important. If you miss a dose, then you should take that dose as soon as you remember. If you miss 2 doses, you'll want to call your provider and ask what they recommend you do, and you'll also want to use a backup method. If you miss more than the 2 doses, definitely come in for emergency contraception. You can access that here at the clinic, and it's a pill that's called Plan B. And then there's also an IUD that can be used as a backup emergency method. That's not available in this clinic, but we can get you set up at one of the other Denver Health clinics if you wanted to use that as your as your emergency contraception, and then as your backup birth control, and it'll just be your birth control from now on.
Okay.
Yeah. The patch is something that you wear on your body. can put it on your shoulder, on your buttocks, on your inner hip. It's very discreet, and you only have to think about it basically once a week. And so you change it at the same time on the same day of each week for 3 weeks in a row. And then on the 4th week, you give your body a break from the hormones, and you will still have a period.
Okay.
And I think I forgot to mention that with the pill, you do have 3 weeks of hormone pills. And then on that 4th week, they have what's called sugar pills. So you'll actually get your period. Is that something that's important to you, or do you have any preference about whether you have your period or not?
I think I'd be okay if I didn't have it.
Okay.
I guess the only thing that would worry me about it is not getting it and thinking, what if I'm pregnant?
Okay, sure. Yeah, that's a very important preference that you're talking about. So, if there's times where you want to purposely skip your period, you actually can with a pill.
Okay.
Some people do choose to continue the next pack of pills. When you get pills from here, the provider will give you 3 months worth of supply for this pill. So the way that would work is you would do 1 week, 2 weeks, 3 weeks, and instead of starting your sugar pills, you would start the next packet, and that would cause you to skip your period.
Okay.
Yeah. And so some ways that you typically would look for pregnancy, of course, is if you skipped your period.
Yeah.
But there could be other ways to tell, breast tenderness, nausea, taking a pregnancy test.
Okay.
Those would be some of the ways. And it is okay, and providers do say it's okay to skip it at least 3 times in a row.
Okay.
There are other pills that are packets that are built just for that, because women say they do want to skip their periods. So if that's an option for you, we can definitely look at that.
Great.
Yeah. And then the next option that we have is called the ring. We actually have a little sample for you here. We can take a look at that. This isn't the same one in the picture. This is a newer model, but this ring right here, you do have to change out every month.
Okay.
You just insert it once, and it would go inside the body, and it would go something like this. So you kind of just twist it and fold it. And some people find that either laying back on the bed helps, or putting a foot up on the shower tub or the toilet seat. And the way that you know that it's inserted correctly is if you don't feel it when you're walking.
Oh, okay.
Yeah, so if you want to take a look at that and go ahead and play with the model, and you can pull it out if you want to, that way you can feel what it would be like. And the aloe vera, that one's actually good for 1 year. So instead of having to go to the pharmacy every month and picking up a new one, you would just be able to keep that one in for 1 year. And the way that this one works is that you can take it out for sex for up to 2 hours.
Okay.
You can only do that once in a 24-hour time frame.
Okay.
And it is okay if you leave it in during sex. As you see, it's really stretchy, so your partner would be able to be comfortable with it. And you can just put it in the little case. Make sure that when you do put it back, if you're rinsing it, only use cold water.
Okay.
Don't use hot water, because it can activate the hormones.
Oh, okay.
Yeah, and that's another great long-lasting method that just came on the market.
And like you said that you would change it out every month, could you still get your period with that as well?
You can, and anytime that you start a new birth control method, you can expect some irregularities to your period.
Okay.
There can be some lightening of the period, there could be heavier periods, there could be spotting, and then that usually is for the first 3 to 6 months, and that can change the longer the person uses the birth control.
Okay, perfect.
Yeah, can you remember how long you can take this method out before it's not effective against pregnancy?
2 hours?
Correct. Yes,
in a 24-hour period.
that's correct.
Alrighty.
Yes, and then do you remember which temperature of water is okay to use when rinsing and putting it back?
Cold water because hot activates the hormones.
Yes,
Right.
correct. All right, great job.
Thank you.
Yes. All right, and on the same tier of birth control protection, we have the shot that's also called Depo. And the way this one works is the patient will come in every 3 months, get a shot in the arm, and you don't have to think about it for 3 months. And unfortunately, you can't change your mind with this one. So once it's in your body for 90 days.
Okay.
Yeah, so any kind of side effects that are going on, which could be like headache, changed period, that's with you for 90 days. And then another thing to remember with the shot is you have to remember to schedule your appointments on time so that you get them at the end of your 90 days. And if you happen to go over a week or more time, then you should be using a backup method to make sure you prevent pregnancy. Okay. Do you have any questions about that one?
No, I don't think so.
Okay. Do you have any questions about the pill or the patch?
Is the patch really sticky, or what if I'm worried about it like peeling off or?
Yeah, that's a great question. It is designed to stick to the body for 1 week.
Okay.
And it can withstand wetness. So if you're like on the swim team or if you take showers every day, it's gonna be fine with that.
Okay.
As long as you replace it once a week, it'll be sticky enough to withstand all your daily activities. Or even if you're like running outside because you play tennis or run track or something.
Yeah. Okay, perfect.
Yeah. All right. And for this one, I wanted to share with you that if 100 women used these methods, 6 to 9 in a year would end up pregnant with these methods.
Okay.
And that goes back to, the use. It could be if somebody forgets to take their pills or doesn't pick them up in time or doesn't change the patch or maybe taking out the ring too often. So what we call typical use.
Okay.
That could lead to that.
Perfect.
Okay. And then going up to the tier 3 methods, if 100 women use these, less than 1 to none would end up pregnant in 1 year.
Okay.
And so these are all inserted by a doctor. We're gonna ignore that one because we don't do that one here at the clinic. We don't do sterilization on teenagers.
Right.
Yes. But we do have these long-acting methods, like the implant. And I'll show you what this looks like. So this one is called Nexplanon, and this is like the size of a little matchstick. Go ahead and play with it. And then when you're ready, you can feel on the model right here.
And this is what goes in the arm? Okay.
Yeah, and then if you touch the little skin piece, that's what it would feel like in the skin.
Oh, okay.
So the provider will have you come in or the patient come in, and depending on which arm is your dominant arm, if you're right-handed, they'll choose your left arm to place it. They put a numbing agent on it. You'll lay down on your back. They'll have you put your arm up, and then they insert it in you. So it's kind of like an ear piercing or something. It's very quick.
Okay.
Once that is done, they'll put a patch on you, and then you can leave it on for the rest of the day, just to try to keep it from getting infected or anything. After that, it's in your body, and the hormones are good for 3 years.
Okay.
And then at the end of 3 years, if you're ready for a new one, you can get a new one. Or if you decide you want to change methods, we can talk about that too.
Okay.
Yeah.
And if I were to get the implant, this Nexplanon, how long would I have to wait until I could do like sports or stuff like that with that arm?
Yeah, great question. So you shouldn't have to change any of your physical activity.
Okay.
If you're into weightlifting, if you're, playing softball, you can resume your sports right away.
Okay.
One of the things that you would have to think about waiting on is having sex, depending on when you get the implant. So if you get it inserted on the Sunday after your period, then you will be protected from sex. But if you get it inserted before your period, or depending on where you are in your cycle, then you would have to use a backup method just to make sure that you don't get pregnant.
Okay.
Yeah. So we can definitely send you home with some condoms today if you decided to use that one.
Okay.
And it is a recommendation to use backup with any of these methods, just because they don't protect from STIs.
Okay.
Yeah, they all protect from pregnancy, but don't protect from STIs.
Okay.
Okay?
Yeah.
Do you have any other questions about the next one on?
I do not.
No?
No.
And then do you remember how many years it's effective for?
3 years.
Yes.
Okay.
Yes, and this one contains a hormone called progestin and a hormone called I'll get back to you on that second one when it comes to my mind.
Yeah, that one's, I don't know how I feel about something being inserted in my arm, but that's definitely a cool option.
Yeah, and they do numb your arm, so you wouldn't feel it.
So it wouldn't hurt.
I mean, everybody's pain tolerance is different.
Yeah.
So it just depends on, your pain tolerance level. And the provider might say that you can go ahead and take your preferred method of over-the-counter stuff that you use for pain.
Okay.
Maybe a few hours before, and you can talk to the provider if you have questions about that, and let them know what they recommend for that. And to go into the Mirena and the IUD and the Skyla a little bit, I actually have some samples here for you to check out.
Okay.
This is going to be the Mirena, and that is the same size. And then this one's the copper IUD. And the way that the insertion process looks like for this is the provider would have you come in, they'll have you get undressed only from the waist down, and then you'll sit on the table. Your legs will be on like 2 stirrups, so you'll be open, ready, and then what they'll do is come in with something similar to this. I forgot the name of it. I was gonna call it a scapula. Similar to this speculum, and they put lube on it, and then they insert it. And then the next step is they get a device similar to this one, and then measure the length of the cervix. And then once they have an idea of how far they'll need to go, they come in with the IUD. This one has the arms up, but the one in real life, the arms would be down.
Okay.
And then they'll insert it, and once it's inserted, the provider will leave it in there. And that whole process can take 15 to 20 minutes.
Okay.
Cramping and a little bit of pain is normal for that procedure, but you're in and out the same day. I would say that sports and stuff, maybe take it easy for the day of.
Okay.
And then the next day you should be fine, good to go. Same thing with that one, your provider might recommend over the counter if you're worried about any cramping or pain, anything like that.
Okay.
And the great thing about all these methods is that they instantly prevent pregnancy. So if you're worried about having to use a backup method with these ones, you don't need to. It's more just to protect you from STIs.
Okay.
And then the great thing about these long-acting methods also is that as soon as you have it taken out, you can get pregnant.
Okay.
So let's say that you got it taken out and that same day you had sex and you ovulated that day, you would become pregnant, or you could become pregnant that same day.
Okay.
Yeah. Have you ever heard anything about the IUD before, or?
Not much about them.
Yeah.
No.
Sometimes there is a myth that you can't get pregnant after having the IUD. What people might not realize is that even for someone who's not using birth control or hasn't used birth control, and let's say a couple tries to get pregnant, and the person with the vagina had never used birth control before, they can still take 6 months to a year to conceive.
Oh wow.
And
okay.
that's without having ever been on birth control. That's because it can take a long time.
Right. Okay.
Yeah. And a little reasoning behind that is just because of our ovulation cycles. So, has anyone ever told you how you can tell when you're ovulating before?
No.
Okay. So what the provider would do is have you count the first day of your last period.
Okay.
So let's say it was October 1st, and then let's say you had a period that lasted 5 to 7 days. And then let's say your next period happened November 1st. The provider would say, okay, count back 15 days from November 1st. And that's the day that you ovulated.
Okay.
Yeah, so sometimes people use apps to kind of try to track those days if they have really consistent periods.
Okay.
But it's harder for someone who might have like some short periods and then some long periods or kind of like inconsistent periods. But let's say that person did have those pretty consistent periods. If you were to count back 15 days from November 1st, then you would know that's the day you ovulated, right?
Okay.
So that would be October 16th, I believe. So let's say October 16th, right? This is like if you had a 3D view and you were looking inside your body.
Okay.
So the ovaries release an egg once every menstrual cycle, and then that egg sits right here in the fallopian tube and then waits for a sperm to come meet it. And if they meet and come down to the uterus and attach themselves to the lining here called the endometrium, then a pregnancy can result.
Okay.
So the interesting thing is that the egg that comes down, it's only viable for 12 to 24 hours. Yeah. So it doesn't stick around for a long time.
Okay.
Yeah. And then another fun fact is sperm can live inside the person with the vagina's body for up to 5 days. Yeah.
Oh, wow.
So let's say if you had sex on October 1st, would you get pregnant?
No.
No.
Because
Right.
I wouldn't be ovulating.
Yep.
Okay.
Yeah. So let's say you had sex on October 18th. Would there be a chance of you getting pregnant if you ovulated on October 16th?
No, because it only, or is it yes, because it only, it would?
You're right, it's no.
Right, because
Yep.
sorry, I had to, the egg is only there for 12 to 24
You got it.
hours. Okay,
You got
okay,
it. You
okay.
got it. Okay.
Okay.
And then what if you had sex on October 12th?
I could, because the sperm could last up to
Yep.
5 days. Okay.
Yes. Great
Whoa.
job, Amor.
Thank you.
You passed the pop quiz.
Thank you.
I know that one can be kind of tricky.
Yeah.
So yes, there is that window where if you ovulate and then there was sex had, the 5 days before that, then yes, there is a potential for pregnancy.
Wow, okay.
Yeah.
That's good to know.
Yeah, and then since we're talking about that, I'll tell you a little bit about what birth control does in the body.
Okay.
So, as you know, the ovaries release the egg once every menstrual cycle. Well, when birth control is taken, one of the things that the hormone tells the body to do is tell the ovaries not to release an egg. So if we don't have an egg, if a sperm gets in the body, then there's no chance of pregnancy because you need both, right?
Right.
Okay. And the second thing that happens or can happen with birth control is taken is this lining right here that's in the uterus, the endometrium. It usually gets thick and bloody and has good nutrients so that when that egg and that sperm come down, called a zygote, if they meet up and come down, it has a good environment to survive. But when birth control is taken, it tells this lining to get really thin. That way it's not a good environment for that egg. So even if it does drop down, it really probably won't survive because it doesn't have a good environment to live in.
Okay.
And then it would just flush itself normally out of the body. Okay. And then the third thing that birth control can do is right down here, there's a cervical mucus, and normally this mucus can be thin like an egg white. And when birth control is taken, it gets real thick like jello, so that if sperm comes in, it probably won't make it all the way up here. Yeah, so those are 3 things that birth control can do. Do you remember one of the methods that birth control can do in the body to prevent pregnancy?
Yeah, it tells the ovary to not release the egg, so that if sperm comes in, there's no egg for it to fertilize.
Exactly.
Okay.
Perfect. Yeah. And then, do you remember one other thing that it does?
Birth control can affect the lining in the uterus, so it doesn't create a viable environment for a zygote.
Perfect. Yeah. And then the last thing, of course, could be this cervical mucus getting really thick. And then, do you remember if birth control, does it protect against STIs?
It doesn't.
What can you do to protect against STIs?
Condoms.
Yeah.
Is condoms the only thing that protects against STIs?
That's a great question, Amar. I'm so glad you asked that. So condoms are a very, very good way to protect against STIs.
Okay.
And another method that you can use to protect against STIs is making sure that you ask your partner if they've been tested before. Yeah, testing is recommended at least once a year by medical professionals if you're with the same partner. If there's multiple partners, then testing recommended more often. If it seems awkward, like to ask your partner if they've been tested, something that you can say is like, hey, I got tested on October 14th and my results were negative. When was the last time you got tested? And then that might make your partner feel more comfortable. And then if they don't have any idea what testing is, you can let them know, like, hey, there's the clinic. You can go down, make an appointment. Yeah, exactly. Yeah, and what that looks like is usually just simple, like peeing in a cup, and then the provider will send the results to the lab. The results will get back in about 2 days. And then depending on what the results are, the provider will have the medical assistant call the patient down and let them know what the results were. And if treatment is needed, then you'll get that for free here too.
Okay.
And all of that is confidential.
Perfect.
That was a great question, Amar. Yeah, do you have any questions about STIs or STDs or any of the methods that we went over?
I don't think so. As far as STIs, you said you treat them here?
Yes, so let's say if a patient's STI results came back positive, then the provider would call them down and let them know what the results were and then give them the medication so that they can start taking them, and then it will be up to the patient to follow through.
Okay.
Yeah, and if the patient's partner comes to the school too, then we encourage them to have their partner come down. And for patients that might struggle with letting their partners know, we can also do like a courtesy reach out if necessary.
Oh, okay.
Yeah, so let's see here. So we talked about STIs and birth control methods. And then I also wanted to let you know that we do have emergency contraception. So just in case if you don't start birth control and if you have unprotected sex and need access to emergency contraception, we can prescribe the Plan B here. You would need a visit with the provider. She would take a pregnancy test, I think, and then do the STI exam. And then you'd be able to leave here with your emergency contraception.
And how long after sex would I have to come down to get a Plan B? Would it be that same day? The next day.
Great question. So like, let's say if you left school on Friday and then you had unprotected sex that night, you could come in Monday and get the Plan B.
And I would still be okay?
Yeah.
Okay.
Yeah, 72 hours, that's the key.
Okay.
For anything longer than that, the longest, the one that you can wait the longest with, it would be the Paragard.
Okay.
But again, that's not available here at the school, and that would have to go through one of the other Denver Health clinics, which we're happy to help you set that up.
Okay.
So the best thing to do is carry, some condoms as a backup method,
Okay.
and we can help provide you with some of those before you leave today. If you're
perfect. Thanks.
Yeah, you're welcome. Any other questions? Anything else I can help you with?
I don't think so. I think you answered all of them that I have for now.
Okay. Can I help you get an appointment set up for one of the methods today?
Yeah, I would like to. I know I said I didn't want it, but I think the implant would be a great choice for me, and I just wouldn't have to worry about it for 3 years like I would have to worry about the pill every day.
Yeah, that's true. And if you are still thinking about the pill, we can also talk about ways that you can get good at taking the pill. You can set an alarm on your phone, or what can be helpful is like doing it with something else that you do at the same time every day. For example, taking it after you brush your teeth.
Okay.
Like if you're like, you know what, I always wake up and brush my teeth, and that's one thing that I do. Or you could take it at night with dinner or after soccer practice, or whatever's in your schedule every day. That's one thing that you can do that we suggest.
Okay.
Another thing you can do is download an app like bedsider.org. If you see it right here, there's the little logo.
Okay.
I think I remember you mentioned that you had a smartphone.
Yes,
Yeah.
I do.
Yeah, so
that would be a good idea.
Yeah. So if you're like really techie, then you're all about the apps, that might be a great way to remind you.
Okay.
It can track that for you. And then anytime you have other birth control questions, that's a great reference for you too, would be the bedsider.org.
Okay.
You can compare the different methods. So yeah, that's a really great place for you to get some references from.
That's awesome. I think I might have to try that out before maybe I jump the gun and go to the implant.
Okay, for sure, Amor. Well, I'll send Daisy a message to help you get you scheduled.
Thank you.
Thank you.